Fixing broken or damaged everyday objects can be a hassle in our everyday lives. However, attempting to fix a damaged or broken object at an anatomical level can be even harder, as you can imagine. There have been many new discoveries in medicine with the development of technologies that have allowed us to attempt such repairs. In the article, Gene Therapy Can Cure Lameness in Horses, Research Finds, published on October 18, 2017, in conjunction with Kazan Federal University, Moscow State Academy, and the University of Nottingham, a new treatment with the potential to repair such damages was discussed. Gene therapy.
So what is gene therapy? In its literal definition, gene therapy is the addition of new genes to cells to replace missing or malfunctioning genes. The use of gene therapy to treat lameness in horses was outlined by the article. As of the publication of the article, gene therapy of equine tendon injury had never been done before. However, they reported 2 successful cases. The first was a dressage 13-year-old purebred stud horse, having shown lameness for more than 10 days, and the second was a dressage 9-year-old half-bred Trakehner gelding horse, whom exhibited lameness for more than 25 days.
These 2 lame horses were treated with plasmid DNA encoding 2 therapeutic species-specific growth factors named vascular endothelial growth factor 164 and fibroblast growth factor 2. Vascular endothelial growth factor 164 and fibroblast growth factor 2 genes were specifically used because VEGF 164 is a member of the large VEGF protein family, which promotes the creation and migration of endothelial cells, which are cells that line the interior surface of blood vessels and lymphatic vessels. FGF2 was used because it is a dominant protein family that shows broad spectrum in mitogenic and angiogenic activity, or in more simple terms, the signaling of cell division and the formation and development of blood vessels. The plasmid DNA containing these 2 proteins was then directly injected into the site of injury, which in the case of these 2 horses was severe injury to the suspensory ligament and superficial digital flexor tendon. The biotechnology behind gene therapy is gene cloning, which involves the use of expression vectors in order to replicate the proteins of interest, which in this case would be the 2 species-specific growth factors, VEGF164 and FGF2, described before. An expression vector, called a plasmid, is a DNA molecule that is attached to a DNA fragment of interest and introduced into the cell for replication. The plasmid and the foreign DNA are cut by the same restriction enzymes, and when mixed, they pair up, joining the plasmid and the foreign DNA. DNA ligase will then be used to seal the sugar phosphate bonds or glue them back together. Once the foreign DNA is inserted into the gene of interest in the middle of a restriction site, the proteins that are of interest are replicated by the plasmid. In preparation of the plasmid DNA containing the proteins, the pDNA was dissolved in a tube of 5 milliliters of sterile 0.9% sodium chloride solution to a final concentration of 1 milligram per milliliter. The dissolved pDNA was then stored at 4 degrees Celsius in a refrigerator overnight, with occasional gentle stirring and overturning. Before the solution with the pDNA was administered into the injury site, it was warmed to 37 degrees Celsius. Then 3.5 milliliters of pDNA solution was used to fill a syringe that was then injected into the site of injury with the use and guidance of aseptic conditions and ultrasonic guidance. After the administration of the pDNA, the leg was tightly wrapped and the horses then received stall rest for 2 days, with prescribed walking for 3 weeks.
Lameness is a problem commonly seen among the equine industry and specifically high-dollar performance horses. It can be detrimental to any equine athlete's career. With gene therapy becoming a way to cure lameness, this could revolutionize the way people view their horses' injuries. As this therapy becomes more widely used, the price should decrease over time to make this more affordable to a wide array of clients.